We'll see. Here, baby.
Oh.
All right. I'm live. Oh, I like it. I like it. All right. So the big, beautiful bill has now passed. And so, how will this bill affect? Hold on. Lord have mercy. Jesus. Okay. How will this bill affect the marketplace? Okay. So, if you have marketplace insurance, then you definitely want to tune in because I'm going to go over exactly how the big beautiful bill act will significantly reduce availability of coverage in the health insurance marketplace, and is there something you can do to make sure that you have coverage. Okay, and so real quick, if you are new to me or to the channel, my name is Katrice, and I am a licensed health and life insurance broker, paralegal, and your wealth architect. And I help women entrepreneurs and professionals to grow, protect, and secure their finances and to secure a financial legacy that they can be proud of. Okay. All right. So, um, I know you've heard a lot about how this bill will affect Medicaid and food stamps or SNAP. Okay. But another thing that is really going to be affected is the health insurance marketplace. Okay. Or ACA, ACA Obamacare. Okay. And so, this is really significant, especially for entrepreneurs, because a lot of entrepreneurs get their health insurance through the marketplace. I am one of those entrepreneurs who gets my health insurance through the marketplace. And so, you know, for over 10 years, um, you know, the marketplace has been available for people who do not have access to affordable coverage. And it's been a godsend for some, for others not as much. But you know, the fact that we've had it, if you think pre 2014, the way health insurance was, where they, the only way you really had health insurance was if you could get health insurance as if you were healthy or if you had it on your job. If you had any kind of pre-existing conditions, you could not, you weren't eligible for health insurance in this country. And so, the ACA really was a godsend for so many people because they were able to, quit their jobs if they wanted to go out on and become an entrepreneur. They could quit their jobs and, get health and still be able to get health insurance. Okay. Well, a lot of that is changing. The marketplace isn't going anywhere, but a lot of people will probably lose their health insurance coverage. Okay. And so I'm going to break down, I have my notes here, and I'm going to break down exactly what's going to happen, what changes are going to be taking place, so that you can prepare for it. Okay. Now, a lot of these changes will be taking place come 2026. And so that's right. That's like 6 months away. And so you definitely want to make sure that you stay up to date with what's going on, especially if you have health insurance through the marketplace. Okay. All right. So the first thing I want to talk about is the automatic re-enrollment for individuals receiving premium tax credits by requiring annual re-verification of tax credit eligibility. Okay, so up until now, when you first enrolled, filled out the marketplace application, and you put in your information, you got approved for your health insurance. Okay, for the subsidy. It wasn't for the health insurance; it was for the tax credit, the subsidy, the premium subsidy to help subsidize your premium. Okay, well, you know nearly 11 million people currently are enrolled through automatic or passive re-enrollment in 2025. Okay. Now, starting in 2026, that is going to change. Currently, the marketplace uses your information your prior information. So you go in, update. Some people don't update their applications. Those who don't, then they are automatically re-enrolled based on the information on their application. Okay. Um, and so then the marketplace will kind of verify your data with the IRS just to see if it's, around about the same. And then, everything, the credit and everything is kind of like automatic. Okay. Well, that is going away. Okay. Now, you're going to be required to submit updated information on an annual basis to receive your tax credit. Okay. And so if you do not submit this updated information, then you're not going to have your premium subsidy. Okay. And so, which means you're going to have to pay out of pocket the full amount. Okay. For your premium. Okay. Which can run anywhere from 300 and up, depending on the type of plan you choose, the level that you choose. Okay. Now, the next thing is that it eliminates the provisional eligibility for premium tax credits while applicants are awaiting their eligibility determinations. So if you, through the marketplace, when you go through the marketplace and they say that they need you to submit documentation, you still get the tax credit while you are submitting your documentation and waiting for the marketplace to, verify everything and approve your subsidy. Okay. That is going to go away. And so now the marketplace is going to require that you pay the full unsubsidized premium. Now, this can take anywhere from weeks to months while your application is being verified. So if you say are conditionally approved for, say, $300 a month in subsidy, which would bring your premium down to, say, 100 and something, you're not going to be able to pay that 100 and something, say $102. You're not going to be able to pay that reduced premium until the marketplace has verified you. And depending on how long it takes the marketplace to verify you, it could be months. Okay. And so you're going to have to pay the full price until you are verified. Okay. Another big one is it's going to remove the cap on the amount of tax credits that enrollees must repay to the government if their income changes during the year. Okay. And so whenever I am talking to somebody about their health insurance, I always tell them, if you have changes throughout the year, you need to go in, update your marketplace application, or let me know, and I can go in and I can update the application for you so that come at the end of the year when it's time for you to reconcile, that your application, the income that you have on your application is around the same, consistent with your what your actual income is for the year. Okay. And so tax credit amounts are based on the income expectations for the year. Okay. So currently, if you receive excess premium tax credits due to your income exceeding your expectations, then you repay the excess during the tax filing process. Okay. Now that amount that you pay is capped. Okay. But under the Big Beautiful Bill Act, all premium tax credit recipients are required to repay the full amount in excess, regardless of their income. Prior to this bill, it was based on your income. Okay, that is going away. Okay, and so this would add additional financial risk to subsidized enrollees who often experience unpredictable incomes. So that would be entrepreneurs and those who have lower incomes. Okay, and so this is going to really be it makes it harder to to predict what your income is going to be. Which is why another reason why it's really, really important that you keep that marketplace application updated, so that you are can be as spot on as possible. Okay. It also is going to shorten the enrollment period back to what it was pre 2020. Okay, so the enrollment period used to be from November 1st to December 15th. And then after 2020, with the American Rescue Act, they started to lengthen the enrollment period up until January 15th. Okay. But now that is going to go back to November 1st to December 15th. And so it's going to give you less time to enroll. And so 40% of all enrollees for 2025 enrolled after December 15th. I know I personally had quite a few clients who they kind of drug their feet and they didn't, do what they needed to do before December 15th. And so it was January when they, actually got around to re-enrolling and submitting their new applications. So going forward, if you do not have your application in by December 15th, then you will not be eligible. You won't have your health insurance. Okay. Now, if you're new to the marketplace, then you won't be able to get marketplace insurance unless you have a special enrollment period. And if you are not new, but you don't, update your application, then you're going to, if you have, which this kind of segues into the next thing, where if you um, if you don't if you're paying like a $0 premium on your plan this year, it's not going to automatically be zero. You're going to have to pay like $5 um, until you go in and update your application for them to make sure that you still qualify for the $0 premium. Okay. It also is going to end the monthly low income special enrollment period and for state-based marketplaces, the special enrollment periods based on income. Okay, and this had to do with the American Rescue Act. They had a special enrollment period for people with low income. So if your income was lower, it gave you an additional opportunity to enroll in health insurance coverage throughout the year. And so that is going to go away because it's going to add barriers through enrollment, because now you're going to have to verify your income. Okay. Um, Another big one is it's going to get rid of the cost sharing reduction payments. Okay. And so this means the cost sharing reduction is on the silver level plans. Okay. So when you get a silver level plan, you may pay a little more in the monthly premium, but when you go to use the plan, the cost sharing, which is what you pay out of pocket, is a lot lower. Okay. But that is going away. Okay. So the less generous tax credits amounts and increased premiums for subsidized enrollees is going up. And so starting in 2026, this could potentially limit how many insurance carriers will actually be in the market. I know Aetna CVS has already decided that they are no longer going to be participating in the ACA, which really saddens me because I had Aetna. I don't have it this year, but I had it last year. And they are really good. It was a really good plan. And so that kind of saddens me that they're not going to be in the ACA markets anymore. But this bill is just really going to, make it a lot harder for Americans, especially entrepreneurs, to get health insurance. If you are an entrepreneur, that your income, you don't quite have that full, stability in your business yet. You're just getting started. You're kind of, trying to get your footing, and you need health insurance. The ACA Marketplace was really great to get health insurance, just to have that coverage. And so, this bill is really making it a lot hotter. Now, as far as for if you live in a state where Medicaid was expanded, okay, um, you know, if you were low income and your income was low enough, then you qualify for Medicaid through your state. With all of the changes that's happening with Medicaid, you more than likely will not qualify for Medicaid through your state anymore. And then um, those changes, that is going to mean that more people are not going to be back looking to the marketplace for health insurance. And with the premiums and everything going up, then it is going to have a lot of people that will be uninsured because they don't qualify for Medicaid anymore through their state, but they also don't have the income to afford the premiums for the plans on the marketplace. So there's going to be over 11 million people, and I'm being conservative with that number, but there's going to be over 11 million people that are going to not have health insurance. Okay. And this policy is really going to destabilize the marketplace, and it's going to reduce access to health insurance coverage and increasing the number of uninsured people in the country. And it's going to kind of go back to what it was pre ACA. Okay. Um, Now, what can you do um, if you can't get health insurance through the marketplace? Well, if you don't have a whole lot of serious medical conditions, you can look into getting short-term health insurance. Um, Short-term health insurance, it is underwritten, so it does go off of your health. But just because you have, say, high blood pressure or high cholesterol or even diabetes, that doesn't automatically kick you out of getting health insurance. It may, those conditions may not be covered. It really just depends on the insurer, or there may be like a wait time before the insurer will cover those conditions. Um, but you definitely want to um, short-term health insurance is an insurance that you can look into because it will cover like major stuff. So if you were to go into the hospital, it will cover up to like $1 million, $2 million of coverage if you were like to go into the hospital. Now it does cover doctor's visits. They do cover doctor's visits. Depending on the plan, is how many doctor's visits it will cover. If you are somebody who you only go to the doctor, say just, you might have high blood pressure, but it's controlled by medication. And so you just go to the doctor maybe once every 3 months, 4 months, just to get, you do your blood work and then, get a refill on your medication. It does cover doctor's visits for things like that. Like I said, it is a wait time on if they will cover, um, the condition, any complications from the condition. But that really just depends on the insurer. Also, if some of them do have drug coverage. Others, you might have to use one of they might have like a drug savings, but some of them do have drug coverage. And then there are also national PPO plans that are available specifically for entrepreneurs that you can look into getting. They're not subsidized, so you would have to pay the full premium, but they are definitely something that is, it's worth looking into because they do operate just like the marketplace plans. Okay. So you definitely can look into those. There's also health sharing that you can look into, especially if you are healthy. You can look into health sharing those plans as well. Okay. So, I do have a fact sheet that if you want a fact sheet that breaks down everything that I just went through, it is from the American Hospital Association. I do have it linked in the description of this live, so you can go in and you can check that out. And it goes in depth on all of the changes that are going to be taking place with the marketplace. Okay. And so that's what I have for you in this live. And so I hope you found value. And if you did, please do share this live out with others so that they will get, so that they'll know exact changes that are going to be taking place with the marketplace. Okay. And if you have specific questions and you would like to, for me to answer those questions for you, you can book a complimentary consultation with me, where I can sit down and I can answer your questions, and then help you to find the um, that would be good for you and your situation. Okay. All righty. And so remember, the way to secure your finances, your financial future, is to protect it now because tomorrow is not promised. All right. And so have a good one.